Let me check and make sure I'm on here real quick. Let's see here. I always hate figuring this out. You'd think I'd have it figured out by now, but sometimes it takes me a minute. So welcome everybody. If you can see me, if you are on here, send me a little message that says you can see me so I know. It's not showing me as live. Refresh. There we go. It does look like we're good. So awesome. So hi, everybody. Thanks for joining. Happy Monday. Tonight, we're going to talk about gut health and inflammation and dive a little bit deeper into that because I know it's such a common concern for so many people. And so I like to do what I do and educate you on the things you need to know. So if you don't know who I am, my name is Lindsay Venn. I'm a PA, a registered dietitian, and a metabolic health practitioner. I have my own private practice at Venn Integrative Medicine, as well as I'm the medical director at Insulin IQ. So if you want to find me, you can go to either of those places. And obviously you found me on Facebook one way or another. So let's just dive into it. I've got kids traveling and stressing out about their flights. So I apologize for any pinging that is going on while they stress out a little bit about a delayed flight, like I'm sure many people are experiencing about nowadays. Let me share my screen and we'll get into this. So perfect. So hopefully everybody can see that okay. Again, we're going to talk about gut health and inflammation and kind of do that in a 2-part or 3-part scenario where we talk about the inflammation first, the microbiome second, and then things that you can do to see how you're doing and what might improve things. So again, you can find me at Venn Integrative Medicine. Google me, find me here, message me here. And if you want one-on-one help, you can certainly book a consult. So as always, there's your disclaimer. I am not your doctor or your provider. I am not giving personalized medical advice. I'm just educating on, I don't even want to say the basics, but some in-depth stuff when it comes to your gut. So most people, when they think about gut health, they think about how they feel. And so that can be anything from acid reflux, constipation, diarrhea, pain, bloating, gas, you name it. And so we're talking about all of those things as well as what causes them and what you can do to improve them. And so let's start with the inflammation piece, like I said before. As you can see here, I've got the 2 pieces that are well known, which is Crohn's disease and ulcerative colitis. Those are both inflammatory autoimmune diseases. And this one over here is meant to represent IBS. IBS stands for either irritable bowel syndrome or inflammatory bowel syndrome. And it's kind of the catch-all diagnosis when you have GI problems, but nobody has figured out what's causing them. And so it's just a broad blanket statement on your gut. And so we will include IBS in with these other inflammatory processes. So what symptoms might someone experience if they have inflammatory gut issues? I hope everybody can hear me okay. Let me turn this up just to make sure. That's probably actually a little better. First of all, pain is one of the major ones, and this can be in your abdomen or it can be in places like your joints or, just overall, what we call myalgias, which are muscular pain. It can also come with diarrhea and or constipation. Sometimes people have both. You can have gas and bloating. You can actually have mood swings from this because our gut is so tightly correlated with our moods and our mental health. Things like nausea and vomiting can be common. Dysglycemia. Dysglycemia means irregular blood sugars. It doesn't mean high, it doesn't mean low. It means that they're just abnormal when it comes to where they should be. And then another symptom is weight gain. As you all have heard me talk about before, one of the primary drivers of insulin resistance and therefore weight gain is inflammation. And so if you have an inflammatory bowel condition, you probably struggle with your weight. So what are the causes of these? The first 2 that I mentioned, of course, were there, the Crohn's disease and the ulcerative colitis. But other problems can be a dysbiosis or an inflammatory process going on in the gut. And I'm going to go over an example of some stool testing here in a little bit, and we can show you where that plays in a role. Insulin resistance actually can lead to inflammatory bowel problems. When the gut becomes insulin resistant and you develop leaky gut, insulin resistance plays a major role there. So definitely a problem. Same with diabetes, since diabetes is just, and when I say this, I mean type 2, that it is just insulin resistance on steroids. So that's obviously a problem. Poor diet, a very inflammatory diet with refined processed carbohydrates or refined processed seed oils can be a problem. And then actually there's a lot of medications that can cause issues with the gut. So we're going to talk about each of these in more detail. So when it comes to the autoimmunity piece, this is your body attacking different parts of your GI tract. What differentiates Crohn's from ulcerative colitis is that Crohn's disease can happen anywhere in the GI tract, anywhere from mouth to anus. You can have an autoimmune response and create problems. Ulcerative colitis is specific to the colon. It only happens in the colon and tends to be quite problematic, but it is limited to the colon only versus Crohn's, which can be anywhere. The ulcerative colitis does tend to have a lot more diarrhea, can have bloody diarrhea as a matter of fact, and it does tend to have a little bit more pain than Crohn's, though I have a lot of patients with Crohn's who also have quite a bit of pain that they suffer from. So what is the treatment for this? If you have an autoimmune condition, what do we do? Well, as a dietitian for 30 years now, we were taught just to adjust your fiber intake. If you were having no flares, everything was going great, they wanted us to work you up to a higher fiber diet. If you were having a flare, we wanted to significantly reduce the amount of fiber to get you through that flare. It's kind of crazy because these are autoimmune conditions. They're not too much fiber or lack of fiber conditions. They are autoimmune conditions. So the traditional treatment did not address the autoimmunity at all. And that's what I do a little bit differently. As you can see here, my recommendation is actually, and I do this for all of my patients with bad inflammatory bowel, is to put them on a carnivore diet. Carnivore diets in themselves are very, very anti-inflammatory, which is the primary driver of autoimmune disease as well as inflammatory bowel conditions. And so I'll put them on a carnivore diet a minimum of 2 weeks. A lot of the times we'll go 4 to 6 weeks. And then we start the food reintroduction piece of this. A lot of my carnivore patients feel so much better that they don't want to reintroduce other foods. They've been struggling and suffering. They've not been able to go to work. They can't leave the house without an extra set of pants. They have a lot of problems. And if carnivore fixes it for them, a lot of times they don't want to go back. But a lot of people too really struggle with the strictness and the limitations with the carnivore diet, and they do want to reintroduce foods. And we do that in a very stepwise strategic strategy to help people be able to reintroduce successfully and have a little bit more variety in their diet. There are other anti-inflammatory strategies as well. So nutritional ketosis, again, if you've listened to me before, this is the most powerful anti-inflammatory strategy you can implement. So whether you go full on carnivore or even if you just go on a therapeutic ketogenic diet, inflammation will come down and some of those symptoms will definitely improve. A lot of times we do start with a low to no fiber diet. And this is because I tell people to think of fiber kind of like sandpaper in a really raw wound. You know, it's fiber. It's going to irritate the GI tract. And so we start with a low to no fiber diet to start. And then of course, avoiding those inflammatory foods that I mentioned before, your refined processed carbohydrates, refined seed oils. We're going to talk about some other foods that are problematic as well. Again, in the traditional world, they're going to want to put you on medications for this. The problem here is these are all immune modulating medications. They're trying to calm down your immune system so you have less autoimmunity driving the Crohn's or the ulcerative colitis. That's great for the Crohn's and the colitis, but it is not great for your immune system. If you think about it, you're more prone to bacterial infections, viral infections, poorly healing wounds, etc. So they're not, for sure, not my first line. There's many patients out there who have to go that far, but if we can get it down with natural strategies, that's certainly my preference. So let's talk about the other piece of this, dysbiosis. And so dysbiosis, people think of, okay, what does that mean? Well, your microbiome plays a major role in what's going on in your gut. And dysbiosis can mean you have too many of a certain kind of bacteria, you can have not enough of certain kinds of bacteria, or you can have both. You can have too many of one kind, not enough of another kind. And we've got this picture that is a poor microbiome. So what can you do to prevent this? Biggest one out here, do not use antibiotics unless you need to. And I don't want to say don't use antibiotics ever, because there's times in your life when you're going to need them. But if you don't need them, if it's just a cold or a sinus infection or something along those lines that you can tough out, we certainly want to avoid the antibiotics if you don't need them. Overuse of probiotics can be a problem. This is that too many of a specific kind of bacteria, your microbiome, that you're putting in too often, too frequently, and too much of. And so we don't want to create a SIBO, or a small intestinal bacterial overgrowth situation, by overusing the probiotic supplements that are out there. High fructose corn syrup is another dietary thing that causes a lot of problems, so do your best to eliminate this. This is for a huge variety of reasons, but it definitely negatively impacts your gut. The seed oils I mentioned you want to avoid. Processed foods and preservatives can cause problems, and it's not just the fact that they've been processed, it's the stuff that they put in them, the preservatives, maybe the antibiotics that were used in the chicken or beef or whatever it is that you're eating. You want to make sure that you're getting organic if you can. Next on here is unfiltered treated water, and treated here is the key word there. If you live on city water, your water has been treated. And so they'll use a variety of different things, chemicals that will negatively impact your microbiome. So if you live on or drink city water, you definitely want to get a filtration system of some sort, even just a pitcher in your fridge for the water you're drinking out of, because the things that your water was treated with can be very harmful. Excessive alcohol use can be a big problem here as well in the microbiome. Having an excessively sterile environment, we all did this, or not all of us. I didn't do it because I hate hand sanitizer, but COVID did this to all of us, where we were just being extremely cautious when it came to bacteria and other infections. And so we want to try to get dirty every now and again. It's actually really good for your microbiome in the gut as well as on the skin. And then lastly is antacids, and we'll talk about those a little bit more too. Because they change the pH of the GI tract, they do cause problems with the microbiome. So we want to avoid those if possible. So what are symptoms of dysbiosis? So they're all listed here. They're very similar to the ones that are associated with inflammatory bowel disease. Pain is last on the list here on purpose. People will have pain with dysbiosis, but not to the extent of the inflammatory bowel disease. But you can get reflux, gas, bloating, nausea, diarrhea, constipation for sure if your microbiome's not in check. So what do you do? How do you treat this? Well, it depends. We don't know. And that's why there is testing that I'm going to go over here in a minute. So it really does depend on what the cause is. If you have dysbiosis from recent antibiotic use, you likely have a underpopulated microbiome. And so we need to augment that with either fermented foods or with probiotics. If you have a very low fiber diet and your body needs fiber, maybe we need to add more fiber, or vice versa. If your body doesn't like fiber so much, maybe we need to decrease that dose. It really is a true N of one scenario. Fermented foods are a wonderful thing for most people to be able to try. If you're not sure, you don't want to spend the money on the testing, you just don't know where else to turn, addition of fermented foods is probably my first strategy. So you just have to pay attention. And a lot of people don't know this. They think, oh, sauerkraut, if I buy it on the shelf, I'm getting a fermented food. Well, no, you're not actually. Fermented foods have to be in the refrigerator section, and they have to say that they're fermented. Pickles are a great example of this. You can get fermented pickles, or you can get pickled pickles. Pickled pickles are not fermented. And so you need to make sure that you're getting the ones in the refrigerator section that are truly fermented. If you can, stop the medications that are causing the problem. Again, a lot of times these are these antacids. People who have been on, Prilosec or something for a long time, their microbiome is completely screwed up. You don't want to stop those medications cold turkey. By no means, do not stop those cold turkey, but you do want to work on weaning off of them to help that microbiome. If your diet's a problem, we need to change it. And we'll talk about that some more. Again, antibiotics, I put here, I didn't put stop or start here. If you have SIBO, if you have overgrowth of bacteria in your gut, you might need to take antibiotics to help knock that back. If you have poor microbiome or underpopulated microbiome, you want to avoid antibiotics all that much more. And so antibiotics are a tool that we need to make sure that we manage appropriately. And then there are supplements. There's lots of supplements out there actually to help the microbiome either do better or worse. If we need to knock back some of that SIBO, we can use different supplements if we don't want to go as far as antibiotics. So what is the best strategy? If you can, I really recommend the stool testing piece. This is really, really, really helpful. And the example I'm going to show you next, I have a patient that I just sent her stool results to last week, and we were going up the wrong tree. And so the stool testing has completely changed our strategy with her, and she's already feeling better, and it's not even been a week yet. So if you can afford it, the stool testing is really helpful. Breath testing is another option. What they're looking for here is what kind of gases you are blowing out that your microbiome is producing. So these can be for SIBO specifically. They can also be for, I did my thesis on a sucrase isomaltase deficiency. And so we could test for that with breath testing. So there's different things that you can do there, but the stool testing is by far better. Adding in the fermented foods and cleaning up the diet. Those are the basics that if you can do them, we want you to do them. So let's go over an example of a stool test report. And so this is a Genova stool test, and for her, it showed up like this. They go through and they color code them and say, okay, are you having issues with maldigestion or inflammation? Is it this dysbiosis piece, or is it a metabolic imbalance? She had both of those. Or do you have an infection that we need to be concerned about? And then they have different generalized, and I always say this to people, they say I have different generalized recommendations down here. This is not specific to her. This comes out on every single report. And so that's where having a provider interpret this for you is really, really helpful. So on the next page of the report, it actually goes through it. So we're looking at digestion and absorption here. And so it measures the amount of digestive enzymes that are present. Hers were at a good level. And then it measures the amount of things that she's pooping out that we maybe don't want to be pooping out. Cholesterol was the only one that was high. The rest were at good levels. And so her digestive enzyme piece is just fine. We don't need to do anything with that. This fecal secretory IgA gives us an idea too on inflammation. So inflammation wasn't a concern, for example, here. And then we get into the metabolites or the metabolic part of this. And this is where she had struggled and scored a pretty bad score. The short chain fatty acids and butyrate that are low are really a problem. These are metabolites that the microbiome produces when they're being fed appropriately to help with things like mental health. Mental health is fantastically improved when short chain fatty acids and butyrate become more optimal. And so really important to know that this is something we need to work on. Excuse me. As I inhale my spit. So the next one of these, this is the top half of the page. This is actually looking at a few of the microbiome that they actually test for. And as you can see, many of hers are in this low to low normal category. She only had one that was a little bit higher here, but the rest of these were in that low to low normal category. She was recently on antibiotics, and so that's probably why. And it kind of shows us the impact that had on her microbiome. The second page is similar, lots of low to low normal. This Akkermansia one is a good one to also check in people. She doesn't struggle with blood sugars, but Akkermansia is really great for blood sugar control. And so if she was having blood sugar control, this would be an instance where we might actually give a supplement of Akkermansia to help with the blood sugars. And then the last page, this was the thing that was the most strategy changing piece of information. She had a lot of candida in her stool. And so to me, this is where we're going to go, okay, this is probably, she struggles with a lot of bloating, constipation, that are really problematic for her. And so we're going to go after this candida now rather than going after the microbiome. We're also going to encourage fermented foods where her microbiome was so poor. But this one was the big trigger probably for her symptoms. So on. Oh, and that, by the way, those tests, you have to order them through a provider, but they're cash pay. Insurance won't cover them. So this test specifically runs about $400, and it gets mailed to you and you just mail it back in. So just something to keep in mind if anybody's interested. So the next one that I talk about all the time, insulin resistance and diabetes. And the reason that we talk about these is because of leaky gut. Leaky gut becomes a really big problem because what happens here is these tight junctions, these little junctions in between the lining of your GI tract are really important that they're tight because we want the poop, which is out here, to stay out here. We don't want it to enter into the bloodstream like it does over here. This is when we have things that are getting into our bloodstream, into circulation. that technically should not be there. And the problem here is that these cells become insulin resistant and they form these leaky junctions that lead to leaky gut. And then the remaining part of this is the inflammation associated with having that transfer of essentially stool into the bloodstream that we don't want. So what do you do for insulin resistance? Again, this is 93% of Americans. So chances are that you have it or someone you know has it. What can you do? Number one, intermittent fasting is super powerful, really, really beneficial and powerful when it comes to lowering insulin resistance. Typically, when I talk about intermittent fasting, we're talking about a 16-8 or an 18-6 strategy. We don't have to do longer fasts necessarily. And so that's important. Controlling your carbohydrates, particularly the refined processed ones. If you're doing more whole food carbs, that's better. If you really struggle with insulin resistance, type 2 diabetes, poor blood sugar control, we really want to get most of those carbohydrates cut out. Prioritizing your protein, filling with healthy fats. We're going to talk more specifically on fiber in just a minute. Making sure you're getting the movement piece in, particularly things that will help with muscle mass. So resistance training, Pilates, body weight resistance training, using the weighted vests if you're a walker, that kind of thing can be very helpful. Managing your stress, doing what you can to get that inflammation down, and of course, managing those blood sugars, very important. The poor diet piece. If your diet looks like this, make it look better. It's really that simple. If you are doing a ton of processed foods, your gut is going to pay for it. I always tell people you are what you eat. And when I say that, I mean your gut is your microbiome is what you eat. So if you're eating junk, your microbiome is going to be junk. So avoiding processed foods, try to get organic foods where you can, again, because of what they've been treated with, the different pesticides when it comes to fruits and vegetables, or things like antibiotics that are used in our animal products. Avoiding the high fructose corn syrup, keeping alcohol intake down. And then again, with the unfiltered water, if you're on city water, you want to make sure that you find a way to filter that. So let's move on to those medications that I talked about, because these ones are a big problem. I mean, a lot of people, you can get these all over the counter now. And so if somebody suffers from reflux, they're like, oh, I'll go get some Prilosec and my reflux goes away and I'm doing that much better. Well, their symptoms are that much better, but their microbiome is paying for it. And so some examples here, there's ones called proton pump inhibitors or PPIs. And those are, I have them listed, your Prilosec, Nexium, Prevacid, or their other generalized or general names. H2 blockers are like your Zantac, though apparently they just recently removed that. And so those are different kinds of antacids. They work on H2 receptors. And then even things like our antacids like Tums and Rolaids, all of those are going to negatively impact your microbiome. If you are on a proton pump inhibitor or an H2 blocker, again, do not stop these medications cold turkey. You will have a rebound effect and you will have so much acid being produced that you feel like you're going to die. So work with your provider to wean off of these as best as possible to help your microbiome. Antibiotics, again, we want to avoid unnecessary use. They might be necessary if you have SIBO. Again, you won't know this unless you get tested for it, but in that case, we do want you to actually take an antibiotic or something to knock back those bacteria if we're treating the gut. I get this question all the time. What about probiotics when I'm taking antibiotics? If you're taking antibiotics for a respiratory infection or a UTI or something outside of the GI tract, yes, I do recommend to take probiotics while you're on your antibiotics. They don't counteract what the antibiotics are doing at all. They're just going to keep that microbiome in the GI tract from being as greatly impacted. If you are treating the GI tract, don't take probiotics. We want to give it a few weeks after the antibiotics, and then you can repopulate that microbiome, ideally with fermented foods, but if not, you can use a probiotic. So, and then again, remember that there are antibiotics in your non-organic foods, and so you want to pay really close attention to where you're getting particularly your animal products from. So what about probiotics? So if you're going to take a probiotic, I do recommend to take a high quality multi-strain supplement. Things like Culturelle that we have over here are lactobacillus. Lactobacillus is a great probiotic, but it's only lactobacillus. So we want to make sure that we're not just overpopulating lactobacillus into your GI tract. We want to populate a variety of probiotics into that tract. I do not recommend to take these regularly. And so my patients who need them, we will put them on a cyclic schedule. So they'll take them for 2 weeks on and 2 weeks off, typically for just a bottle or two worth. And then we go back into, a diet that's rich in prebiotics and probiotics just to maintain that microbiome where we want it. So this is one where I recommend to spend a little extra money. They do need to be temperature regulated. So buying them on Amazon is a bad idea. If they get too warm, it kills all of the probiotics in it and you're just wasting your money. And so using a store like Fullscripts, which I have, I can certainly share the link, is a really good idea because they do temperature regulate their probiotics, all their supplements, and they do have the high quality ones available. So let's move on to fiber. What about fiber? This is a really controversial topic. There's a lot of people out there who swear by their carnivore diet and do not want to have any fiber. There's lots who swear on a high fiber diet that they do significantly better. And I am in the mindset of we do whatever is going to work the best for you because not two people's microbiome are the same. So there's two kinds of fiber. There's insoluble fiber and there's soluble fiber. Insoluble fiber is the kind that our GI tract can't really digest and absorb. And so it works just like a chain link fence inside of your gut. It's going to create this nice fencing that the soluble fiber can then stick to. When the soluble fiber can stick to that fencing, it does a lot better because it'll stick around for the microbiome to be able to feed off of. Soluble fiber works very much like a prebiotic, what we would call food for your microbiome, if it stays in the GI tract long enough. If you think about things like Metamucil and Benefiber, many people take that for constipation, and that's because it rapidly moves through your GI tract, creating a bowel movement. If you want to feed your microbiome, that doesn't do you any good. You need to have the insoluble fiber component there too. And that's why we like you to get a large variety. We want your foods or your supplements to really, really have both soluble and insoluble fiber to optimize your microbiome. And then what about the dose? This can vary. Like I said, this is an N of one kind of scenario that you really need to trial and error. If you are feeling great on a low to moderate fiber diet, great, stick with it. There's no reason to push it further. If you are not, maybe you try pushing it further. Maybe you try cutting it back. It really just depends. And this is where I talk about the N of one situation. For those of you who don't know what N of one means, that is doing the testing on yourself. You're just taking a one-person case study of yourself and figuring it out. And so you can try a no fiber / carnivore diet. See how you feel. I would give it at least 3 to 4 weeks before you make a strong assessment on how it works for you. You could try a regular fiber diet. And by this, I mean somewhere in the 20 to 30 grams of fiber per day. Or you could try a high fiber diet, which is pushing it up closer to 50 grams per day. If you really struggle with your gut, you can try all of these. You just have to be intuitive and very observational when it comes to your symptoms and how you're feeling and how closely you're following the diet, like I'm suggesting. So another option, and I really like this option because it's hard to get in 25 plus grams of fiber in a day, is the Feel Great system. So Balance is their fiber supplement, and this is what is so very unique compared to Metamucil and Benefiber. It does have both soluble and insoluble fiber. So it's doing the job of that large amount of variety of vegetables. So you can actually have both of these in something simple. It tastes great, it's easy to take, and it can fix the microbiome problem just by doing this once a day. It will also help to improve your insulin resistance and diabetes, which is the cause for the leaky gut. And it will stimulate the Unimate part of it will stimulate glutathione. And glutathione is another wonderful antioxidant, anti-inflammatory molecule that our body makes naturally that we can actually ramp up production of with something like the Unimate. So you're hitting a lot of what we need. You're hitting the fiber component, you're hitting the insulin resistance component, and you're hitting the anti-inflammatory component. Plus, if you follow it the way we want you to, it will promote that nutritional ketosis to further drive inflammation down. Very, very important and a great option for those who don't want to eat bowls and bowls and bowls of vegetables every day. So what is the best strategy? I said here all of the above, and it is all of the above. We want to get your inflammation down. Again, you can use Unimate for the glutathione. You can follow a ketogenic diet, different strategies like that to keep inflammation down. Make sure your diet is clean. If you're putting inflammatory things in your GI tract, you're going to still struggle with problems, both the microbiome and inflammation. Following an insulin smart diet to help improve that leaky gut and insulin resistance. removing your processed foods and avoiding your antacids, avoiding the unnecessary antibiotics. And then you can consider things like the Feel Great system and probiotics or fermented foods. Again, fermented foods being the best strategy. And if you need additional help or if you want to order that stool testing, you can certainly contact me. I'm happy to set up an appointment with you and go over all the pros and cons. There are different levels of that testing depending on what you're struggling with. And we can walk you through it and then help you interpret those results and create a treatment plan that will work best for you. So I'm going to stop sharing my screen and see if there's any messages in here that I need to respond to. Let me find it, if I can find it in here. And of course, I can't find it on that one. Let me find it on this one. And of course, it doesn't want to pop up. It's always great when technology works, not so great when it doesn't. That's for sure. Oh, there we go. Thanks, Bobby, for commenting because you just saved my bacon on that. All right. Bobby says it's so complicated. Yes, it is. It's very complicated. The microbiome is like the universe. We have just barely touched the surface when it comes to understanding the microbiome and the things that you can do for it. And that's where I just really encourage people to think about the way that people ate 50, 80, 100 years ago. And there was a lot of roughage. There was no antibiotics. There was no antacids. There was, foods that were not tampered with when it comes to hormones and et cetera. So really trying to get back to more of an ancestral way of eating is really, really smart. So perfect. I don't have any other comments tonight. So if you didn't catch this live, you can certainly go find it on my YouTube page. All of my recordings are there. It's under Venn Integrative Medicine. And, I think there's like 30 of them now on that site, and we'll keep adding to them. So perfect. Everybody have a wonderful night. Happy Monday. My kids are on their way, so I'm excited to see them tomorrow. And I'll do my best to keep posting this week, though it's kind of a vacation week. So we'll